Subluxation is a misaligned vertebra putting pressure or irritating or chafing a nerve. Good. So all the muscles in the hands, all the sensation in the hands and fingers are controlled by nerves here in the neck. If you're someone that suffers from carpal tunnel syndrome, where you have numbness or even pain in the wrist, hands, or palms, typically at night or in the morning, but it doesn't just have to be at those times, but it is typically worse in the morning or at night. If you're one of those people, you need to watch this video. We're going to go over how we treat it and some exercise to rehab the carpal tunnel in the forearm region. Number one, it's an overuse injury. So you want to make sure that during an overuse injury, you are mitigating those overuse risks. So whatever you're doing to overuse it, stop it. So she is on a computer all day. So we had spoken about her ergonomics. She's improved that, right? Things have gotten a little bit better. Cold laser therapy is one thing that we can do, and we've shown in the past, we've shown cold laser treatments. We've already done cold laser treatment on her on both wrists already, so I didn't want to show you guys that and bore you with that, because that can take 5, 10, 15 minutes in some cases. We did both of her wrists, and we've been doing it now for a few weeks. It's improved a little bit. She's a stubborn case. You have a subluxation right up here at T1, right? So when you were doing those exercises, your fingers were weak on the outside.
Yeah.
Right? So the base of the neck, those nerves that go to those muscles, that innervate those muscles, right here, you have a subluxation right there. You feel that?
What is
Subluxation is a misaligned vertebra putting pressure or irritating or chafing a nerve. So go ahead, take a deep breath in for me. And blow all the way out and just relax here. Good. Good. Okay, and tuck your chin down. A little sensitive right there?
Yeah.
Okay, not so bad here?
Not so bad.
Take a deep breath in and blow all the way out. Okay. All right, turn over on your back. So all the muscles in the hands, all the sensation in the hands and fingers are controlled by nerves here in the neck, mainly at the lower part of the neck, okay? All of these nerves here run down, control the sensation in the arms, hands, and fingers. So as you can tell, you know, with carpal tunnel syndrome, it's important not to have subluxations in the spine, especially in the cervical spine.
Please.
So typically numbness in the hands can come from two things. We know you have carpal tunnel syndrome, but some of the numbness and tingling can also be coming from the neck. And we won't know that unless we get an MRI done of your neck. And just relax yourself here, and I want you to wiggle your toes for me. Yeah. Good. And here, relax yourself. Good. Okay, let's check your wrists and elbows.
So it might be coming from the posture, right?
What's that?
It might be coming from the posture.
What, carpal tunnel syndrome or your neck?
Well, both, I guess.
Both.
Yeah.
Yes, absolutely. Ergonomics, how you're set up in front of your computer, definitely.
Can
I'm going to open your arm up Sorry, go ahead. What were you
Can
going to
it
say?
be sleeping posture as well?
Sure. Some people sleep with their hand tucked under like that.
I do
Funny
that a lot,
position. That's not
actually.
good. Yeah. You need to
And I
try
do
to
that,
avoid
like,
that.
But like it happens unconsciously, so it's like I'm trying to
Sure.
stop it.
You're
but-
sleeping.
Yeah.
Yeah, you got to try to avoid that. Okay. Okay, I'm going to open the arm up. I want you to resist me. Ready? 1, 2, 3, resist. Any pain when I do that?
No, really.
Okay. And I'm going to push in. I want you to resist me. 1, 2, 3, resist. Yeah, so that was weak there. That was a radial test. And 1, 2, 3, resist.
Okay.
That was weak. So we're going to just adjust your elbow here. Just relax yourself here. Okay. And now, on 3, 1, 2, 3, resist. Okay, better. Was that painful?
It's not painful. It's just like I can't really.
You don't have the strength.
Yeah.
1, 2, 3, resist. That's much better.
Yeah. It is much better.
And 1, 2, 3, resist. That's much better too. Okay, let's just check this wrist. Thumb to pinky. Yep, and don't let me open them up. 1, 2, 3, resist. Good. Thumb to pointing finger. Yep, and 1, 2, 3, resist. Good, and relax here. Okay. And 1, 2, 3, resist. Good. No pain, right? And 1, 2, 3, resist. That was weak. And 1, 2, 3, resist. That was weak too. Okay. So something's going on with your elbows here. We're going to adjust the radial head here. Okay. Now, 1, 2, 3, resist. That's better. 1, 2, 3, resist. Better. Any pain when I did that?
No.
Good. Okay, now pinky to thumb, hold that together. 1, 2, 3, resist. Good. Good. Now pinky to pointing finger. 1, 2, 3, resist. Good. Excellent. And just relax there. I'm just checking the median nerve when I do that, and the ulnar nerve when I do that test, okay? That helps me to just check the nerves, check my work, that's all. Okay, now, relax here. So, number one, you can buy one of these kits on Amazon. I'll leave the link below. Here's like a jelly ring. I'm gonna have you just do this. And then the other hand, I'm gonna have you squeeze that ball. She's got it in both hands. So this is sort of like a jelly ball. You just wanna have them squeeze that and work the muscles in the forearm here, the flexors. Yep, and then the carpal tunnel region. Great. Okay, and then you can take a 30-second break. And then you're gonna do, in 30 seconds, you'll do another 10 to 15 squeezes, okay? So let's go for 15. I think you can do it. Good, and this kit comes with one of these, which you can adjust the tension. Comes with this for the fingers. So we're gonna go through all of these. Now switch hands.
Oh.
Yep, and they're really the same thing, but they're just a little bit different squeezing and a little bit different tension as well. Which one's harder?
This one's harder.
That one's harder?
Yeah.
Okay, the ball. And you'll wait 30 seconds, and then we'll do one more set of 15. Okay, now that we're done with that, now you're gonna take this, you're gonna put your fingers in here. So your thumb in the big one. Yep. There you go. And you're gonna open your fingers up. Do this. Yep, so you bring your fingers together and you open them up. There you go. It's great. This kit is, I don't know exactly how much, but it's really not expensive. It comes with all of this. This is a great set to kind of rehab any wrist or hand and finger injuries that you might have. Carpal tunnel is probably the most common. If you've done physical therapy, it's hard, right? Yeah. You can also, so let's say you don't have this, right? You can, if you have in the office, you have a couple rubber bands, just take a few rubber bands in the office and put them around your wrist. That way it reminds you to do the exercises when you see them on the wrist. And you just roll them up to the tips of your fingers and you do this. And you add another rubber band to make it more difficult to do as you get stronger and stronger. You don't necessarily need this. And you can use a hacky sack, you know, or something if you have another kind of silly putty, you know, is another thing. If you don't want to buy these tools, that's fine too. And this, you could use a can of soup, or you might want to go with a little bit heavier weight. Dumbbells help. This is a 5-pound weight. We'll show you how we use this. Good, now try the other side. All right. Yep. Getting tired already?
Yeah.
So what we wanted to do was use the laser to calm the inflammation down in the carpal tunnel region before she starts to strengthen it. And a lot of times I see in physical therapy, they'll start these strengthening exercises right away, and sometimes that flares it up and makes it worse. So we're going to do that with the cold laser therapy, and we'll make sure she does some of these stretches at home. We're going to show you a few stretches too. Okay, now stop that. Now let's go ahead and stretch. So first, you're going to just go like this against the, stretch down here. No, so you want to go with your fingers at the edge. There you go. You should feel the stretch in here. You feel that?
Yeah.
Good. And breathe in and out. Good. Now, this. So with this, you're just going to take your fingers, one at a time, and then you can do all of them. 1, 2, 3, 4, all of them.
I can't even push one.
Hard, right?
Yeah.
So even to press that one down. So let's just do that. Let's just try. Yeah. So that's something you need to work on. The fine motor skills there. Yeah. You've got those 2 fingers down. That one's a little weaker. Okay. All right.
Oh my god.
Yeah, you're having a difficult time with that one. Okay. Well, let's try the other hand. Are you a lefty or a righty?
Lefty.
Okay. A little bit better with this one, but also a little bit of a difficult time on the smaller fingers. Okay. Yeah. Just not that uncommon with carpal tunnel syndrome. So, okay, we're gonna have to work on that. So we'll send you a custom plan with stretches and exercises, and you can go ahead and get started with that. Now, another one I want to show you is you can do this with a simple dumbbell or can of soup if you have at home. You're probably going to want to go heavier than that, and just do this. And you put your wrist right on your knee, so go ahead and try that for me.
Ooh.
Is that too heavy for you?
It is really heavy.
Is it? Okay. So I take that back. Maybe you can start with a can of soup and work your way up. So as a chiropractor, chiropractors are known to have carpal tunnel syndrome because all they do is all that pressure on their wrists all day. So I can tell you I have carpal tunnel syndrome, but I don't have any pain or numbness, but I have weakness. So I work on, this is an exercise I do, I'm up to 20, 25 pounds where I do that, you know, and I work on these muscles because I'm stronger on the extensors. So I work on my wrist flexors. And go ahead and try the other side. You're gonna do 12 to 15 of those, 3 sets, okay?
Okay.
All right. All right. I'm gonna let you finish those up. Go ahead. There you have it, guys. If you have any questions about carpal tunnel syndrome, diagnosis, treatment, exercises, comment below. Thanks for tuning in.